children of all ages and social class. Mental illness does not discriminate.
Mental health situation in Kitgum is alarming.
It's estimated that over 2 million people in this country are affected.
And that is a very big gap. So only about 20% actually access care.
Many health workers in the beginning professed that really they didn't have the skills, and now they're confidently managing these cases.
So for the first time in Uganda, the program has ensured that now we have a strategic plan in Uganda for mental, neurological and substance use disorders.
We are ready to make our budget to plan for this program so that we sustain it.
Faced with the tough reality of societal stigma and discrimination, 13-year-old Julius from Jinja district, Buwenge sub-county, had to endure his peers and community's negative attitudes and perceptions towards himself and other people affected by mental illness.
This illness started.
I was in class studying, and suddenly I felt unconscious. After receiving treatment, I started getting better. My parents took me back to school, but the school administration rejected me. We finally got another school where I was interviewed and I passed. It is where I am schooling now.
Those are the conditions. And these are...
Majority have been forced to believe that mental illness is a punishment from the gods, and those affected are treated as outcasts. As such, the sufferers are forced to seek help from the traditional healers and sorcerers.
Natuka ekiseera nakuba omukazi nti oba omwana afwe ayidu sente abayigadde bali tulyakuda abwerere nga buli tumutwala gabitawuko abiri nakuntono kyayiramu tumutwala kyayiramu
era nebaza okusookera yala nebaza omusawo eyasooka okundagirira ebudima musawo kyakulaga bwe nayagaana ina mweno health center tu nfunyewo endawulo y'amaanyi kuba buti we bali ku idagala ezira kizibu kyenkafu nakyo nakyona.
Julius's story is one among the millions of Ugandans affected by mental, neurological, and substance use disorders. The alarming truth, however, is that just a small margin of patients get to access proper medical care, creating a treatment care gap of over 75%. Moreover, in Uganda, insufficient resources of less than 4% of total health budget are allocated to mental health.
All researchers in low-income countries indicate that about 80% of the population of people with mental health conditions do not access treatment.
But also there was a very big gap in terms of capacity of health workers to manage mental health, neurological and substance use disorders.
Every month we see over 1,000 patients, the whole district.
Given the magnitude of the treatment gap, World Health Organization launched the Mental Health Gap Action Program, mhGAP, in 2008.
It's a program that was developed for low and middle income countries after realizing that the burden of mental health was increasing, and yet there were not enough specialists, qualified psychiatrists, to handle all those cases.
The need for intervention in Uganda's mental health situation compelled Ministry of Health, in partnership with World Vision, to embark on a pilot project to scale up access to mental health services in Jinja, Kamuli and Kitgum districts in 2012.
So we thought the best way is to integrate it in primary care and increase access by this 80% of the population.
In order to achieve the project goal, numerous interventions were undertaken, including training of health workers of all cadres and all levels of the primary health care, village health teams, district health management teams, other district stakeholders like police, political, religious, and local leaders, among others.
Most importantly, are they able now to recognize that this person could not be, may not be having just malaria, but may be having a mental health conditions, and therefore be able to appropriately refer these people for care.
We were trained to understand how to assess a person with a mental health problem, and we could categorize that we had mainly mental, neurological, and substance use disorders.
We attended a training as pertaining how mental ill person with mental health are supposed to be handled, and how we can prevent it, how we can approach these victims.
Kinyambye nti nkendezeza abaana ab'embeera ngezo mu kitundu. Ekyokubiri tugezezaako kwengambe enkola yange ne poliisi kituyambye okukendeeza enjaga mu bitundu.
Information, education and communication materials were also developed to supplement knowledge acquired by the populace.
This project has enabled achievement of the mental, neurological and substance use policy for children and adolescents, and now mhGAP is advocating through this policy for children to be managed as first-line treatment to be psychosocial support.
Interpersonal psychotherapy for groups has also been very instrumental in restoring hope in the lives of the men, women and children. Facilitated by health workers and village health team members, group therapy sessions such as these in Kitgum have supported men, women and young people to cope with challenges of depression.
Ya grupo konya mina tam ni mera babeta pa mera kachar luar ni to ne wayap to kachel wakegi kubera no rangat te mabar
fonyi mawati yeni tikada ko kona anu no ati dan ma mar ko ful sia da wa beru pin wane no gen ma ko ti maraj ci umio ko be chane adwa cha chat mi mar ko na adwa pin.
So with that help, sincerely, patients were really improving.
Florence Lamwak in Kitgum district is a widow with 4 children. She attempted to drown herself and all her children into a river after suffering from severe depression. Florence was then identified and with her consent recruited into one of the interpersonal psychotherapy groups for women in her village. This has played an integral part in giving such women as Florence hope. To her, this was a turning point. Besides encouraging and counseling each other during the group sessions, these women have formed a village savings loans association within their peer group to help them improve their livelihoods. Likewise, users of MNS services were also supported in Jinja and Kamuli to form peer support groups to enhance their recovery process. They were taken through trainings by Basic Needs Foundation Uganda to learn how to advocate for better health services in their communities, know their human rights, and sensitize the public about MNS issues through their testimonies. His house tenant took advantage of Kiwa's mental condition and grabbed his house in Jinja. This led to numerous legal battles and court sessions as he struggled to recover his property. With the human rights knowledge acquired and the moral support from his peer support group, Fred pressed on with the court cases. Today, Fred is in possession of his land and home after court ruled in his favor.
Musango ajokuwa mukoti ngemisango jona jebantaku okobati naive gali naive omufaliso napo mwana namene omugonga koti eginedereiza ngabadulize bona bana bebaleta mukoti omunana buduze bali kulaga mukoti balaganga zera musango.
On any given day, Fred supports other peer group members, teaching them of their human rights and better farming skills to support their recovery towards living a dignified life. Psychosis had struck Ruth Nakachwa at its worst, and she struggled for 20 years, bringing with it all the havoc of loitering in the streets of Jinja town, eating from garbage collections, wearing dirty ramshackled clothing, and general loss of dignity. For many, she was never going to amount to anything. Today, Ruth is a totally transformed woman. after receiving treatment from Bugembe Health Center 4. She freely associates with people and has since joined the choir ministry at her church and also engages in livelihood activities to sustain herself.
Ntambula ku luguudo twekuba twevuma buli kimu ntambula n'ebimuli nzijukira empya nakijjukira naye nga simanyi drivinga akati bwe natuuka Dr. Mufuma ne banzija ku Masaayi ne baŋŋaana empulira nga bagamba nti nina omusujja ogenda kuba nga terinamu schizophrenia ndowooza mpulira amaloboozi agoogera ebiyimba ndaba ebitambula ebijjo wabafu abatambula abajja okunnyingiramu ebintu bwe bityo akati nemba nga nina n'omusujja buli kaseera tegunzigwamu.
Nakacharus namwagana ku street nga ali ebichafu akuba abantu ngasula ku street.
Like Ruth, other members of her peer support group have picked up the pieces that were left of their lives before getting treatment and are now enthusiastic about life. Users of MNS services have now formed music, dance and drama groups to educate communities through their testimonies about mental, neurological and substance use disorders.
Anti bali batusosola ino nga era olukubona nga kati omutabufuyo nga benda akuba aye buti bwe tubaire tulina group eyaba embina kukina n'emizaano n'ebitontome bityo buti batandise okuvaayo bati bakatusosola ino baidi nti tis a disease for all eringa malaria.
Radio talk shows have played a big role in educating and sensitizing the masses. These have had far-reaching effects, resulting in skyrocketing numbers of patients at the health centers seeking treatment.
Kuva namala omwaka mulamba nga titenduka era ngendooze nkoba kweyita nali mpulisa Dr. Mufumba ngali ku Radio Victoria nawulisa programu eyo nga era osomesa ku lumbe lw'ebirowoozo.
Many patients were stigmatized and could fear to come and talk to anyone that they have a problem. But after this program, we realized that people and patients became free.
A lot has since been achieved during the 4 years.
Stigmatized together with our clients.
The challenge we have is that the police officers that had that knowledge were transferred away, most of them.
There is a huge need to invest better, more comprehensively, so that mental health is better resourced in this country.
We need to conduct what I would call refresher training for some of the health workers. We need to engage more with these districts.
So we would like to see this project rolled out so that other people can also benefit from this kind of intervention, integrating mental health with other services.
The mhGAP pilot project has undoubtedly proven that a lot can be done and achieved in as far as scaling up care for the people affected by mental, neurological and substance use disorders is concerned.
I would like to appeal, first of all, to government where I serve, the Ministry of Health, to continue prioritizing mental health, and the other national NGOs to prioritize the issue of mental health, because many of these organizations are providing services to improve the psychosocial status of individuals in the community. But without addressing the mental health issues, these people will not recover.
That way, the well-being of girls, boys, women and men affected by these disorders will be improved, thus enabling them to live relatively normal lives and making a contribution towards national development as dignified citizens.